Hello, my name is Ryan Coffman. I'm the Tobacco Policy and Control Program Manager for the Philadelphia Department of Public Health. And today I have a very important message to share with you. That is around youth vaping. Youth vaping has been described as an epidemic by the Food and Drug Administration. It's important to take a moment to reflect on what do we know about vaping. So vaping is the use of a handheld, battery-powered device that vaporizes a mixture of nicotine flavorings and other chemicals, which is inhaled by the user and exhaled into the surrounding environment. Nationally and here locally in Philadelphia, vaping is the most commonly used tobacco product among our young people. The Philadelphia Department of Public Health position on vaping is that no young person should be exposed to nicotine in any quantity. That is given that the adolescent brain is still developing well into early adulthood, and that young people are much more susceptible to the addictive effects of nicotine than adults. Vaping at this point in time is threatening to roll back all the progress that's been made in reducing youth tobacco use over the last many years. There's a particular product which I want to give special attention to that is thought to be a strong contributor to this massive rise in youth vaping in the last few years, and that is a product called Juul, which I hold in my hand here. Let's take a moment to consider what do we know about Juul and what are the concerns that Juul raises for our young people. First and foremost, it's designed to be discreet and concealed. As you can see here, it looks and resembles very much a USB flash drive. It also emits a much smaller plume of aerosol when the user exhales into the surrounding environment. This has led to Juul being used in settings where regular tobacco use is prohibited, such as in our schools, school classrooms, and in school bathrooms. Juul, at the launch of the company, also used extensive social media, which had many appealing messages to promote this product to young people. At that particular time. There's also extremely high levels of nicotine in a Juul device. So this pod that you find here at the end of the device can contain the nicotine equivalent of a pack's worth of cigarettes. This is much higher levels of nicotine that you find in other types of vaping products, for instance. There are also pronounced knowledge gaps among Juul users. So many young people, when asked, did not even know these products contain nicotine, let alone that they contain extremely high levels of nicotine. Juul is also found at this moment in a wide variety of different flavors like mango and mint and creme brulee, which are very appealing and enticing to young people. And this is a strategy that was used historically by the tobacco industry to introduce young people to various forms of tobacco products. There are many other types of compatible pods that can go in the end of a Juul device or similar Juul-like devices that can be used to smoke cannabis, for instance, which is another concern that has come about in a school setting, where there's been reports of youth using, sharing, or selling Juul accessories in schools. In summary, I would like to reiterate the Philadelphia Department of Public Health position on youth vaping, that no young person should be exposed to nicotine in any quantity. And I invite you to visit smokefreephilly.org to see how we can work together to stop the youth vaping epidemic here in Philadelphia. Thank you so much for your time.